slide. And this is, I just used this to demonstrate what our challenge is, and I'm going to introduce a couple of concepts to you. But that bottom graph is a graph of life expectancy in the United States from about 1900 to 2000. And you can see it's pretty much a straight line, and that line hasn't flattened out. We're still living longer. And the top graph just shows you how frequently people in different age groups develop these dementing disorders, particularly Alzheimer's disease, and it is powerfully driven by your age. And so if we live longer, our risk of developing disease is going to be longer. Now, I don't know if that went twice or once. Now, this is a concept I want you to understand. So in the top part of that picture just flashed up, the top half of it, shows what happens with increased longevity without changes in disease. So that red colored area can represent Alzheimer's disease or any other age-related disease. And if we live longer and we don't do anything about those age-related diseases, what happens? There's going to be more of us that have those age-related diseases. And the bottom part shows what happens if we introduce something called disease-modifying therapies. That means things that will impact the development, slow the development, or slow the progression of disease. And it doesn't matter what it is. It can be heart disease, it can be cancer, it can be Alzheimer's disease. And so that green and yellow area I want you to think of as the health span of a person. Not the lifespan of a person, but the health span of a person. And I don't know about you, but I would much rather have a longer health span than a longer lifespan. I don't want to spend the last 40 years of my life debilitated. And so that's where we're working towards. So with Alzheimer's disease, there's a lot of things that we know. There are risk factors. Aging is far and away the most powerful risk factor. There are a host of genetic components, so genes that can contribute to your risk of developing Alzheimer's disease. And one of the most critical decisions that you can make if you want to avoid getting Alzheimer's disease is be highly selective in your choice of parents. Okay? Because that is going to contribute an enormous amount. And that's why family history is so important. Gender. Women do develop Alzheimer's disease at a higher rate. Head injury, Dr. Parker mentioned about chronic traumatic encephalopathy, but we also think chronic head injury, repeated head injury will put you at risk of other degenerative brain diseases, including Alzheimer's disease. Vascular disease, cardiovascular disease, all of those things play a very important role, as does lifestyle. Some of those factors, like your selection of parents, is not under your control, and so there's not too much you can do about that. But some of the lifestyle factors and vascular conditions are very much under your control. So let's talk about those things for just a minute. Actually, we went to Coca-Cola recently, and I had a slide like this. And initially, the obesity picture had a Coca-Cola logo. I decided I'd better make that a Pepsi logo. But anyway, these things, obesity, type 2 diabetes, heart disease, hypertension, all of those factors that impose a certain amount of stress and strain on our bodies as we get older will also put stress and strain on your brains and increase your risk of developing Alzheimer's disease and other degenerative brain diseases. And so those are all factors that you want to make sure you control. And you know how to do some of those things. Attention to preventive medicine is critical, and so men are, always a minority in our audiences, and so it's contingent on you women to go home and educate your men, because men we're just dumb. We don't go see our doctors. We don't pay attention to prevention messages. So it's up to you to make sure that your man lives long enough to, maintain you in the lifestyle to which you want to be accustomed. But there are things that you can definitely do in terms of controlling some of those risk factors. There is a tremendous amount of research emerging right now suggesting that aerobic exercise and aerobic fitness is absolutely critical for brain health and also for prevention of degenerative brain diseases. So much so that there are studies that are emerging right now, including one that our colleague Dr. Wharton is leading here at Emory, that's looking at aerobic exercise and fitness as a prevention method for Alzheimer's disease. And this is just one of a number of studies that have looked at the effect of exercise. And there is really solid scientific evidence that exercise will actually reduce the cognitive symptoms associated with aging and also with Alzheimer's disease. That picture reminds me, I heard Ted Turner give a talk once a while ago, and he says, your brain is a muscle, just like any other muscle in your body. Well, it's not a muscle, knucklehead. However, you do have to exercise it like the muscles that you have. Now, so exercise is critically important. Diet is something we also preach. There is a lot of evidence that heart-healthy diets, Mediterranean diets, actually can reduce your risk of developing cognitive impairment and dementia. And this graph just shows the curves of individuals who develop Alzheimer's or other dementia symptoms and plots it relative to the type of diet that you had. So the people on the top line that had the lowest rate of developing Alzheimer's disease had the most heart-healthy diet with the components that we think of in a Mediterranean diet: fresh vegetables, less red meat, less fats, less processed food, more fish, and other healthy foods. And this, I don't know if you can appreciate this. You guys are all pretty much neurologists by this point, right? Okay, good. So what this shows, though, is actually a representative picture of two brains. And the picture on the left is a person who had a more Mediterranean heart-healthy diet. And the picture on the right was a person who had a poor diet, a not heart-healthy diet. And those arrows point to little gaps that show up as dark spaces. Can you see that? There's a difference between the two brains. And those dark spaces represent shrinkage of the brain. And so people who maintained a healthier diet, healthier lifestyle, actually have physically measurable differences in their brains as a consequence of those lifestyle choices. This thing's going to drive me crazy. I'm just going to just skip past this slide, but it just shows the kinds of things that we deal with when we actually deal with patients who have dementia and Alzheimer's disease, and that is that progressive deterioration, which is so terrifying. And it's really, one point that I want to make on this slide is if you look at some of the descriptions on the far right of the slide in individuals who have severe dementia symptoms due to Alzheimer's or anything else, that's the point that's so scary, when you've lost quality of life, ability to interact in a meaningful and enriching way with your friends and families. Earlier on in this process, when people have mild cognitive impairment, the very earliest stages of memory loss, quality of life is excellent. Very few, if any, functional limitations, just maybe some annoyances in terms of memory loss that's sometimes hard to distinguish from normal aging-related changes. And even in mild stages of Alzheimer's or other dementias, the symptoms are relatively mild. But it's that last portion of disease that's so scary.